Nursing homes and similar facilities have been among the hardest hit communities during the COVID pandemic. Health organizations as well as state and local governments have attempted to implement effective testing and surveillance plans within nursing homes to decrease outbreaks and protect residents. We propose a surveillance program involving specific screening and testing policies for COVID-19 in Maplewood Manor that allow for safe interactions between residents and their families with minimized risk of exposure within the community. Screening policies for COVID-19 not only limit spread within high-risk communities like nursing homes, but also may be utilized as a preventative mechanism to reduce exposure risk. Many of the screening practices for visitors and staff within nursing facilities currently revolve around testing individuals by screening for symptoms, COVID-positive contacts, and temperature checks. Unfortunately, these screening practices do not identify the asymptomatic population of carriers. We also recognize that physical separation from loved ones takes an emotional and physical toll on nursing home residents, increasing rates of depression and anxiety. Our plan for testing and surveillance of staff, residents, and visitors addresses frequency of testing, choosing a test based on availability, turnaround time, and accuracy of results, and how testing may be used to allow for families and residents to have in-person visitation. Our proposed intervention will have 3 components: testing, surveillance, and visitation and isolation policies. For testing of nursing home staff and residents, we will perform point-of-care molecular or antigen tests via Quest Diagnostics with samples collected on-site, aiming for turnaround time of 24 hours. In the setting of any new positive cases, visitation will be halted and providers and residents will be tested and continue to be tested every 4 days until there are no new cases for 2 weeks. Testing frequency will then revert to being based off of county positivity rate. When county positivity is less than 5%, asymptomatic residents will not be tested and providers will be tested every 4 to 6 weeks. When the county positivity rate is between 5 and 10%, weekly testing is encouraged for residents who have had outside contact in the last 2 weeks, and providers should be tested every 30 days. When the county positivity rate is higher than 10%, weekly testing of residents and all providers is recommended. The second component of our intervention involves surveillance, including daily temperature checks and screening for symptoms and exposures for everyone. Our third component will be focused on visitations. Maplewood will follow CMS guidelines, which outline the visitation is permitted when the county positivity rate is low to moderate or less than 10%. If the positivity rate is higher than 10%, visitation should be limited to compassionate care only. Visitors must show proof of negative tests taken 2 to 3 days before their visit. We plan to establish partnerships with local community health centers, free clinics, and pharmacies to increase access to testing, as well as hosting a mobile pop-up testing clinic on-site once a week. Visitors must complete a temperature and symptom screening right before the visit and must have appropriate PPE, including a mask and eye protection. Additionally, essential caregivers will be established for patients with high-risk factors for isolation or special needs. The caregiver will work with patients and staff to devise a schedule for more frequent visits and will follow staff testing and surveillance policy. To ensure social distancing during visitation, visitors must register and reserve an indoor or outdoor space via the Maplewood website for a 45-minute time slot. For 3 days prior to their visit, they must complete a daily symptoms and contact exposure self-check on the Maplewood website. The figure shown depicts our proposed intervention where visitors get tested before they come to the nursing home and follow our policies. Data collected includes weekly COVID-19 positive numbers for staff and residents, weekly staff and residents experiencing COVID-19 related symptoms, the number of visitors per day and week, and the number of visitors who test positive after their visit. Our intervention poses a number of strengths regarding testing and surveillance. In addition to reducing the number of COVID cases both within the nursing facility as well as the community, we are providing residents, staff, and family members a sense of security and protecting their health and well-being. The greatest strength of our intervention is its fluidity. Our intervention was designed to be able to change regarding the current infection rates within the facility and the community. There are many challenges associated with implementing these policies for large nursing homes like Maplewood. Having adequate staff to test and care for residents, the affordability of testing, and finding a balance between permitting visitation while prioritizing the safety of Maplewood community is crucial to successful implementation. To address these changes, we have chosen creative solutions like no-touch temperature stations that require only one staff member. We have asked staff to complete self-screening questions online and carry out resident screenings as an integrated part of morning med passes. For visitors, we have partnered with a local pharmacy chain that offers multiple testing sites and have budgeted to subsidize half of test costs for one visitor per resident every 2 weeks. Our policy is flexible and responds to county incidents, while also emphasizing to visitors the importance of social distancing outside the facility.